Welcome to the American Academy of Grief Counseling's video on autism and grieving. And in this video, we're going to look at how grief and autism interact. Now, autism or ASD, autism spectrum disorder, is a neurodevelopmental disorder which is characterized by certain behaviors that are restrictive or inflexible with individuals with their interaction with others or how they are able to process information in itself. It's very broad in degree and intensity across the spectrum itself. However, I think it's very important to note out that in view of it, some consider it a disorder. However, many within the mental health community have challenged this, and many advocate for it being labeled as a neurodiversity paradigm that is merely different than typical divergent individuals. So seeing it as something more diverse, as more less of a disorder, is something that is a debate within the mental health community itself. Now, regardless though, for our purposes within grief counseling, whether it's a neurodivergent difference or if it is a disorder, we still witness various behavioral patterns of neurodiverse individuals that can play a large role in how grief is manifested within those particular populations. So it's important to understand these differences in processing and the abilities of these individuals who socially interact with others during loss. Many, unfortunately, who are neurodiverse or autistic can sometimes fall behind or in between the cracks when expressing grief and loss, simply because maybe mental health care professionals or grief counselors are not able to understand how autism works, especially when an autistic individual is facing a particular loss. And that's why it's so important for grief counselors to be well educated in this particular area. So let's take a quick look at some things that are common with autism and bereavement itself, whether as children or as adults. It's important to notate that those with autism or those who are neurodivergent experience the pain of loss the same as any neurotypical individual. But how they express it is the key difference, and how that sensory information is processed and how they are able to then interact with others. For some, coping and expression of grief is seen through intense emotional distress and meltdowns where the individual will lose control. Others, though, will be on the other far end of the spectrum, and they will show isolation. They will experience shutdowns where they do not want to express. So it's important to know the particular individual and what extreme they might be exhibiting within the spectrum itself. Many are more concerned also about facing change and what happens next, and they have a hard time processing the issue of the now, the pain of the now, and they can become very concerned as they process of what is going to happen now, since this particular person may be passed away, or maybe this particular living situation has changed in itself. I think it's also extremely important to understand that many autistic individuals do not adhere to the many social norms of bereavement. And it's important to understand that while they may not be expressing grief or mourning the way that many individuals who are typically divergent do, it's still important to understand the individual and how they express it and not to show judgment. Instead, it's important to help them to express, understand, and adjust. So helping those within the spectrum with grief is a process that takes some study, some understanding, and is a partnership between the family and also the various counselors themselves. During loss or drastic change that incurs grief, it's important for the family to offer stability, security, patience, and understanding of the autistic person's emotional state that they're experiencing, and to be understanding of the process of how the sensory information is being taken in and how it is being expressed. And this involves, I think, really a no judgment zone about the particular grieving process, showing no judgment and allowing them to express when they feel the need to express, but also with some guidance in helping them how to express. They need to feel, again, safe and stable and secure during this particular process. So therapy really should be tailor-made depending on the extremeness of the spectrum that a particular autistic person might be. So grief counselors who are licensed also and able to help and work with autistic clients throughout most of their life, their scope of practice is obviously going to be greater than grief counselors who are merely pastoral. And in these cases, a particular tailor-made plan should be made for autistic grieving individuals. Again, within these sessions with family, if necessary, the autistic individual or the neurodivergent individual needs to be able to feel safe to express their emotions within the therapy itself. And the therapy also needs to take into account the uniqueness of each individual and their emotional abilities. I think it's very important then to carry that therapy into the home itself and to form a very tight partnership with the family to help the neurodivergent individual, the autistic individual, deal with this particular loss itself. So we are AIHCP, in the American Academy of Grief Counseling. We do offer a grief counseling certification. However, for those who are already certified and would like to enter our grief diversity specialty program that looks at individual groups and how grief affects them, one of them included autistic individuals, then please check out that link as well, especially if you're already certified. Our number is 330-652-7776, and our email is info@aihcp.org. I'd like to thank you for listening and have a good day.